So, since you already have your experience as a teacher and as a student, why did you set up your institute in four different models?
Um, so the idea comes from making a dentistry more understandable for dentists and for non-dental community. And I was thinking on how to make the topics more connected between each other to the, of course, already practicing dentists. Let's say one that has 5 to 10 years experience looks at it differently than the undergraduate student. Yeah. In the undergraduate, we have different specialities. We have the endodontics, the prosthodontics, orthodontics, pediatric dentistry and stuff. There we learn a lot, but somehow in that process we many times lose the perspective. And I was thinking on how now rearrange the perspective on the topics so that we could really grasp this holistic, or whatever we call it, integrative, or just dentistry in essence, so that we are aware of all four major topics that are the infectious inflammations, non-infectious inflammations, functional part, so how we chew, how we move, how the teeth touch in function, and the aesthetic part. These are the four groups. And then we are going module lecture by lecture, so that in around, let's say, 70 to 100 hours, participant then really gets the idea on how to ask the patient the questions when he comes, how to make a plan, and then how to make the diagnostics first, of course, and then how to make a proper treatment plan so that the patient really gets then care, therapies that will be in his mouth for, well, many years. So to avoid this every year I need to do something. So in America they call it drill, fill, bill approach. So that when patient comes, you just do something quickly and that's it. But he comes regularly, and you are at all times doing some minor therapies instead of planning the whole treatments. I would say the whole dentistry in a patient's mind.
So, in what point is the program individualized? Is it depending on which stage that each person is in, or is studying or working at, or is it about the timing, or in which way is it individualized?
So the program is basically individualized in all the aspects. I have been to many lectures, seminars, congresses, and there are only a few where that changed my life. And the program, these programs were always somehow connected with the information on the participants. So what level are they in at the moment? So are they doing surgery? Are they doing only prosthodontics? Which equipment do they use? Which technology? It's very important, because if you are in a congress or in a workshop or some other educational program, and they use the equipment which is unreachable for you, so you can't invest so many money into it, then what can you do with it on Monday when you come? Yeah? So it's individualized, especially in the level of the knowledge that the person has. Of course, I like to have, and always these few where I gained a lot of knowledge, there were not so many participants. So I decided to go from 2 to 4. It depends on the baseline experience, let's say. And in this way, I can really, and my team, of course, we can really focus on the individual. So it's not only lectures and we finish and that's it, but it's an ongoing discussion on implementation. That's why also the time-wise, we are very flexible. Why? Because, for example, when I studied oral surgery, we had modules every 2 to 3 months. And in between, we needed to do some homework on what we were studying in the previous module. Yeah? And that's how basically the investment that I paid, well, the company paid for that education is came back in few months, because all the knowledge was very quickly implemented into daily practice. And that is the important part. The dentistry is more or less private around the globe. And of course, each investment must make sense. And we all know that sometimes, many times, let's say 15 congresses with 500 euros participation fee doesn't give you as much as one with maybe a bigger investment amount. Yeah. But in the end, we need to ask ourselves. Of course, I'm not saying that congresses are something wrong. Of course, they are very good. I like to go. I go every 2 months somewhere, because you meet people, you network. But at some point, in 1 hour lecture, you can't really receive a lot of knowledge. Yeah? It's just some overview or some specific case. But to change your practice, to change your way of thinking, perspective, for that you need some more extensive educational programs, and that's what we did with the institute. Yeah.
Is the institute, let's say, organized so that the people will get the information also about the prices, how to provide prices, how to present, let's say, the prices to their patients? Is it oriented also in that aspect or not?
Yes. There will, if the participants express, so if they want to know on how this works, of course, there is one module where we learn how to, after the diagnostic, how to present to the patient the case. So what we found out, what the A and B plan would be, what the price of the plan would be, how to communicate it to the patient. So it's not just like a robot, but it's somehow supported with PowerPoint slides and everything. It's not so very complicated, so don't be afraid. It's actually very easy in the end, but for the patient it's magic, because the patients for the first time really understand everything that's going on in their mouth. And even in one of the modules we are connecting it to the body. So mouth are part of the body, so we also focus on that. And if participants want, then of course our financial manager that manages our clinics makes a lecture, makes an overview on what maybe the pricing should be, what to expect in certain amount of time, etc. So to me, my personal, of course, wish is that this institute education gets implemented at least in 80% in the offices. And from our experience and from the experience of the first participants, I can clearly share what return on investment would be in each of the stuff that on each of the aspect and the therapy that we will learn. So somehow it goes intertwined. So we learn the hardcore dental topics, but in the background, of course, we must mind what is realistic to be done in their dental offices. So it's not the intention that I tell them what I do. If they do it differently, I will accommodate the content to their workflow, because they can be one dentist, one assistant dental office. They can be 5 dentists, 5 assistants, 3 receptionists dental office. So all the different modules have specifics, and through the lectures we are implementing onto their system, or we suggest changes to be made. Of course, since we have more than 15 years, I think, yeah, 15 years experience by now building this, we would make suggestions on how to change, to change their protocol, so that in the end the return on investment will be better. So this I'm very confident.
So inside of the modules, you have one module that is actually just for the medical personnel, let's say, that are not dentists.
Mhm.
So why is this important for the medical people to know also the dentistry part? Let's say? Why
So,
is this?
yeah, this is very important, because I think that in the last 5 years, around half of the scientific literature came out connecting oral infectious diseases and non-infectious and functional disturbances with the systemic diseases. So basically, if a doctor, bioresonance therapist, naturopath, heilpraktiker, and homeopath, traditional Chinese, I mean, there are many medicines out there. If they want to really be precise in their work, they must mind the mouth. So no, don't forget the mouth. In mouth we have infections, as I said already, metals, and many disturbances that affect the whole body. And I must say that many times we are very surprised how, and even the therapists say, or the MDs, the doctors say, that they clearly see the difference once the treatments in the mouth were performed as they should be. And that's why I said, okay, of course, dentistry is, very long study program, undergraduate, and then we need a lot of experience. But again, in this part of the institute, I think that it's very easy and understandably for the participants. So I will give them the knowledge on how to read the panoramics, which is not so hard, so that the doctor can then check for himself, so he doesn't need to rely on some random dental office. I'm sad to say, but many times, patients have many problems in the mouth and having severe diseases like arthritis, like fibromyalgia, like cancer in the end. And, we need to be precise. And I think that the medical professional should be at least aware of what he has in the mouth. Yeah? And I would give them these basics, but really in a medical language, for the bioresonance language, not in the dental language. Dental language is for the dentists, but in, let's say, 10 to 15 hours, academic hours, I think that they would gain enough knowledge to decide whether the patient really has problems in mouth and if they were solved by their dentist or not. I think it's very important, especially in cases where you come to some point and then you can't move forward. I have many times, yes, patients referred from cardiologists when they want to exchange the, I don't know, heart valve, or orthopedics when they change the hips. Patients come and they say, please, thorough examination and remove any infection from the mouth. And every patient has that. Statistics are awful in this area. 90% of worldwide population, that's the way I search the literature, has gum disease. gum infection, and half of them have advanced periodontal disease stages. So, and that means a lot of anaerobic, very aggressive bacteria. And it's very easy to see that from panoramic and maybe some additional measurements that they will learn in this module.